welcome to Try Right. This is Pack 365. Myself Srija. So in this session, you're going to learn about the ICD-10-CM coding guidelines for injury, poisoning, and certain other consequences of external causes. So in this session, you're going to learn clearly about the underdosing guidelines and as well as the guidelines regarding toxic effects. So underdosing coding rules. So what are the underdosing coding rules? So underdosing codes come from T36 to T50. So you have to use fifth or sixth character 6 denoting underdosing. So a worsening of condition, it is not required to assign an underdosing code. Documentation of taking less or stopping medication is enough. So now how to code underdosing? So underdosing is nothing but it is a less medication than prescribed. So it also includes the skipped doses, reduced doses as well as patients stop medication on their own. So codes come from T36 to T50 category with 6, adding it the last character or 7th character. So example, if there is an underdosing of insulin in the patient record, so you have to assign the code T38.338.3x6A. So change in the condition is not required even if a patient has no symptoms and condition is stable. So still code underdosing if documentation says patient is not taking medication correctly. So do not wait for complications to code underdosing. So when underdosing is never principal or first listed. So this is a very important coding guideline rule. So if underdose causes relapse, exacerbation and poor disease control, so you have to code this medical condition first. For example, patient skipped BP medications. So he resulted in uncontrolled hypertension. So you have to assign the hypertension code I10 as a principal one. Then followed by underdosing of the antihypertensive drugs and additional code as a patient non-compliance. So never start. So never assign this T36 to T50 underdosing code as the principal or first listed codes. So next guideline is regarding how to add the reason for underdosing, that is intent. So underdosing codes must be paired with the reason code if known, like non-compliance codes which are from Z91 category. So Z91.120, it is for financial hardship. Z91.128, it is for other intentional underdosing. And Z91.130, it is for unintentional underdosing. And Z91.14, it is non-compliance with medical treatment. So complication of the care codes are from Y63 category. So this is used when underdosing is due to a provider error or improper medical care. For example, doctor prescribed incorrect reduced dose. So you have to assign the underdosing code categories Y, T36 to T50 and as well as this complication of care codes which are from Y63 category. So this is how you have to code this underdosing with complications. So next is toxic effects. So what are toxic effects? So when a harmful substance is ingested or comes in contact with a person, so this is classified as a toxic effect. What does it mean? So toxic effects, it involves non-medicinal substances such as alcohol, chemicals, pesticides, gases, venoms and heavy metals. So these toxic effects, they are not the drugs taken as a medication. So what are the toxic effect code range? So T51 category for alcohol, T52 for organic solvents, T53 for halogenated hydrocarbons, T54 for corrosive substances, T56 for metals, T63 for venom and T65 for other toxic substances. So what is the sequencing rule for toxic effects? So remember, so you have to always code the toxic effect code first after manifestations. So example, carbon monoxide poisoning has taken place So it resulted in headache. So you have to assign the code toxic effect of carbon monoxide first, and later the manifestation of the toxic effect is headache in this case. So you have to give the headache code as an additional code followed by the toxic effect code. So next is toxic effects intent. So toxic effect codes, they have a associated intent. Means the toxic effects, they involve the harmful non-medicinal substances. Example, alcohol, chemicals, gases and venom. So these codes, they require intent just like poisoning. So what are the intent options? Accidental intent, intentional self-harm, assault and undetermined. So if intent is not documented, so default it is coded as an accidental. So sequela, the late effects, you have to use the seventh character, yes. This is about toxic effect. So next F guideline is about adult and child abuse, neglect and other maltreatment. So this is a high risk exam and complaints topic. So what are the code categories used here? T74 and T76. So T74 meaning it is a confirmed abuse, neglect or maltreatment, whereas T76 it is a suspected form. It is a suspected abuse, maybe a suspected neglect, and also maybe a suspected maltreatment. So these codes, they apply to both adults as well as the children. So what is the sequencing rule? So you have to sequence the abuse or neglect code first, and also follow with the injury codes, mental health condition codes and other related conditions. Example, child with confirmed physical abuse and fractures. T74.12XA, you have to assign for confirmed physical abuse child, and S52.501A for fracture of radius. So next is confirmed versus suspected abuse. So how do you code confirmed versus suspected? So confirmed abuse, you have to code around the range of T74. So this is used when documentation states abuse, neglect and maltreatment. There is no words like possible or suspected. Whereas suspected case T76, it is assigned whenever a documentation states suspected abuse, possible neglect or rule out abuse. So do not code this as in confirmed one. It is still unsuspected one or it is still a doubted one. So next guideline is about the external cause and perpetrator code. So you have to confirm the abuse only when abuse is confirmed, and then you have to add the external cause codes, that is from X92 to Y09 category, to identify the assault mechanism as well as the cause of injury. So how the injury has been taken place. For example, assault by a blunt object. So you have to assign from X99.9XXA code category. And also you have to add the perpetrator code Y07 if known. So who is perpetrator now? A person who causes the abuse is called as perpetrator. So perpetrator may be a parent, spouse or partner, other family member, caregiver and as well as unspecified person. So you have to assign code Y07.0 for parent, Y07.1 for spouse or partner, Y07.2 for other family member, Y07.3 for a caregiver and as well as Y07.9 if a perpetrator is unspecified. So do not add external cause codes, do not add perpetrator codes when abuse is only suspected. So add this external cause codes and perpetrator codes only when the abuse is confirmed. So only in the confirmed cases you have to assign this X92 to Y09 categories and Y07 categories codes. So how do you code in the presence of this mental health conditions? So if this mental health condition is present, you have to code additionally. So you have to code PTSD, depression, anxiety and adjustment disorders. For example, a patient has a confirmed sexual abuse with PTSD. So you have to assign the code for sexual abuse confirmed cases first, then followed by PTSD code. So what to code when suspected abuse, rape or exploitation is investigated but ultimately ruled out? So do not use T76 suspected abuse if the condition is ruled out. So instead you have to use Z04 encounter for observation codes. First rule is ruled out adult or child physical abuse. So if suspected abuse is ruled out during the encounter, you have to code Z04.71 for alleged adult physical abuse ruled out. In the case of child physical abuse ruled out, you have to assign the code Z04.42. So patient was examined only to rule out the abuse, but there is no abuse confirmed, no injuries attributed to abuse. So in this case, you should not use T76, you should not use external cause, or you should not use perpetrator codes. So next guideline is regarding ruled out alleged rape or sexual abuse. So you have to use Z04.41 categories to Z04.42 when rape or sexual abuse is ruled out. So alleged adult rape ruled out is Z04.41. Alleged child rape ruled out is Z04.42. So this is used for this data, it is used for forensic exams. So there is no sexual assault confirmed, and it also prevents incorrect abuse reporting. For example, adult brought for sexual assault exam. There is no evidence. So simply you can assign the code Z04.41. In the same case, ruled out forced sexual or labor exploitation. So in this case, you have to assign code Z04.81 for sexual exploitation and as well as Z04.82 for labor exploitation. So this applies to human trafficking evaluations. So abuse or exploitation suspected, it gives rise to later ruled out. So do not use T76 code for these cases. If a patient evaluated for forced labor exploitation ruled out, then you have to assign the confirmed case as Z04.82. So next guideline regarding complications of care. So what does this mean? It refers to the conditions which is caused by medical or surgical care. It also includes the medical errors, surgical complications, device failures. So what are the general guidelines for complications of care? So what complication of care mean? It is a condition which is caused by medical or surgical treatment, including procedures, devices, implants or grafts, transplants and medication administration errors which are covered elsewhere. So there must be a clear provided documentation that the condition is a complication of care but not just a coincidence. So what is the first guideline? Documentation of complication of care. So provider must link the condition to the care using terms like due to, resulting from and complication of. So coders cannot assume the causality. If a patient has an infection after surgery, it is not enough. So post-operative wound infection must be the complication. This must be the confirmed cases. And the second guideline is pain due to medical devices. So pain caused by implants, processes or grafts or devices which is left in the body after the surgery. So example devices like hip processes, pacemaker, vascular graft and catheters. So how to code pain due to devices? Step-by-step coding. So first you have to assign T code from chapter 19. So codes which describe the device complication, for example, pain due to processes. And then second, you have to add G89 pain code as an additional code. So you have to use G89.18 for other acute postoperative pain and G89.28 for other chronic postoperative pain. So G89 codes, they identify acute versus chronic. They also identify the severity and the type of pain. For example, chronic pain from knee implant is documented in the patient record. So you have to assign the code first for the pain due to internal prosthetic device as well as the chronic postoperative pain as a secondary code. So in this case, what is the important rule? You should not use R52 pain unspecified when a device related pain code exists. So you should not code pain separately if pain is integral to the another complication. So this is how you code pain due to medical devices. And third guideline is transplant complications. So what are transplant complications? So codes under T86, these are used for complications and rejection of transplanted organs and tissues. So whenever a organ is transplanted, if there are any complications arise or if there is a rejection or failure or infection from the organ, so they are coded under T86 category. So T86 category, it includes rejection of the transplanted organ, failure of the transplanted organ, infection of the transplanted organ, and also other transplant related complication. So this kind of complications, they apply to heart, liver, lung, bone marrow, pancreas, cornea, skin, etc. So kidney transplants, they are coded separately, but they are not included here. So what is the sequencing rule for the transplant complication? You have to always code the transplant complication from category T86 first. Later, you have to add the codes for manifestations. So, a transplant complication code is assigned only when the complication affects the function of the transplanted organ. So, this prevents the overcoding routine or unrelated conditions. So, code as transplant complication. You have to code the organ rejection, transplant failure, infection of the transplanted organ or dysfunction of a transplanted organ, but not a transplant complication which is unrelated infection or which is pre-existing disease which is not affecting the graft, or whether it is a new condition that does not impair the transplant function. So there are two core requirements for transplant complication. The first is what is the ICD-10-CM rule? Two codes are required to fully describe a transplant complication. So the first code is T86, which identifies the transplanted organ and the type of complication, whether it is a rejection, failure or infection. And the secondary code, it identifies a specific complication or manifestation. For example, a heart transplant rejection causing a cardiogenic shock is documented in the record. So you have to assign the first code as heart transplant rejection T86.21 and the secondary code for cardiogenic shock, that is R57.0. This is the cut sequence. So you should not never reverse the sequence on the exams. And then what are the pre-existing or post-transplant conditions? So what is the rule? So conditions present before or after the transplant, they are not coded as complications unless they affect the transplanted organ function. So example 1, there is no complication. Patient had diabetes before kidney transplant and still he has diabetes. So in this case, you have to code diabetes only. But in the case 2, in the example 2, patient develops infection that causes the kidney graft dysfunction. So in this case, the infection, it is causing the kidney graft dysfunction. So it is making the graft not to work properly. So in this case, you have to assign the complication code first as well as the infection code. So next is IC21 for transplant organ removal status. So this is used when transplanted organ has been removed and there is no longer functioning. Example like there is a removed transplanted kidney. So you have to assign Z94.0 code for kidney transplant status as well as Z90.5 for acquired absence of kidney. In the next session, IC2 for malignant neoplasm in transplanted organ. So cancer arising in the transplanted organ. So you have to code first the malignancy code. So then you have to add the transplant status or complication code if available. And the next section is IC1D4 for sequencing of sepsis due to a transplanted organ. So what is the sequencing rule over here? First, you have to code the sepsis code followed by T86 and then infection. So sepsis due to infected kidney transplant. This is an example. So in this case, you have to assign first the sepsis code A41.9. Then you have to assign T86.13 for kidney transplant infection. And at last N39.0 for urinary tract infection. So this is how you code for the sepsis due to infection by transplanted organ. So next guideline is regarding kidney transplant complication. So why kidney transplants are always special? Because unlike other organs, kidney transplant may not fully restore kidney function. Patient may still have chronic kidney disease CKD. CKD after transplant is not equal to the complication unless documented as such. So now how to use or when to use T86.1 codes. So you have to use T86.1 only when transplant failure is documented, when it is documented transplant rejection and transplant complication. For example, there is a kidney transplant rejection documented. So now you have to assign the code from T86.11 category. So CKD after kidney transplant. So CKD alone does not mean transplant complication. So taking an example, there is no complication, kidney transplant patient with CKD stage 3. So you have to assign the code for CKD stage 3 as well as the kidney transplant status. Whereas in the next example, there will be a complication and kidney transplant failure with CKD stage 5. So in this case, you have to assign the kidney transplant failure code T86.12 as well as CKD stage 5 from N18.5 category codes. So T86.1 codes and chronic kidney disease codes. So what is the relation between when to not assign T86.1? So many kidney transplant patients, they continue to have CKD even when the transplant is functioning. So when not to assign T86.1, CKD, when CKD is present, when there is no documentation of transplant failure, transplant rejection and other transplant related complication. Now what is the correct coding? So first you have to assign the code for CKD stage, then for kidney transplant status. So how when documentation is unclear? So what you will do when documentation is unclear? So you have to query the provider. So coders, they always cannot assume the CKD when there is a transplant complication. You have to always query the provider and get clarified before assigning a code. So next guideline is conditions affecting the transplanted kidney function other than CKD. So if a condition which impairs the function of the transplanted kidney other than CKD, it is coded as a transplant complication. So now what are the coding requirements here? T86.1, which identifies the kidney transplant complication, and as well as the secondary code, it identifies the specific condition. What is a specific complication caused by the transplanted organ? So next is CKD after a kidney transplant. There is no complication. So CKD alone after kidney transplant is not a complication. So what will be the correct coding? You have to assign the code for CKD stage and then for kidney transplant status. So next is sequencing rule IC1D4 for sequencing of sepsis due to infection in the transplanted organ. So in this case, sepsis is coded first, followed by the transplant complication and infection. When complication codes that include the external cause. So some T codes already include the external cause of the complication. So what does this mean? The code itself identifies the nature of the complication, the procedure or device causing it. There are no additional external cause codes required to assign in this case. For example, there is a mechanical complication of a prosthetic device and there is also a post-procedural hemorrhage. So the T code alone is sufficient for it. So adding external cause codes is unnecessary in this case. So next guideline is regarding complications of care codes within the body system chapters. So most intraoperative and most post-procedural complications, these are coded from the body system chapter involved. But these are not automatically from chapter 19. So now what are the complications of the care? So complications of the care, these are the conditions that occur as a result of a medical or surgical procedure. So they can happen during surgery, that is intraoperative, and after surgery or a procedure, that is post-procedural. So examples of complications of care is like bleeding during surgery, accidental puncture of an organ, post-operative infection, and post-procedural hematoma. Now, where are these complication codes located? They are located in this body system chapters. So most complication codes, they are found within the chapter for the body system involved, such as chapter 9 ICD-10-CM for disease of the circulatory system, chapter 11 for digestive system, and chapter 14 for genitourinary system. So these chapters, they contain specific complication codes related to the organs and structures of the system. So what is the coding rule over here? If a complication affects a specific organ or a system, you should look first in the chapter for the body system. So you have to use more specific complication code available. So what is the example? If a patient develops post-operative hemorrhage of a coronary artery. So look in chapter 9 circulatory system, but not in the chapter 19. So this is how you have to code the complication of care problems. So next is a sequencing rule. So these codes should be sequenced first, followed by a codes for the specific complication if applicable. So you have to always code the body system complication first. So then you have to add the additional codes to describe the type of the complication, whether it is a hemorrhage, whether it is an infection, or whether any associated condition if required. So when you should not use body system chapters means when chapter 19 is used when because the complication is classified as an injury. So the alphabetic index directs you to a T code. So the complication does not have a specific body system code. Examples where T codes are used is accidental puncture or laceration during a procedure, when a foreign body left in the body after the surgery, or a certain device related complications. So here is an example. It is a vascular complication documented in the record. So the complication is post-procedural thrombosis of the vein. So how do you code now? First, you have to assign chapter 9 circulatory system code, and you should not automatically assign a T code. And in example 2, there is an accidental puncture of the bowel during surgery. So obviously, it is indexed to chapter 19 T code. Use T code as instructed because it is a complication, because it is an accidental injury. So in these cases, you have to assign the chapter 19 codes first. So this is how you have to code the complications of care codes when the body system chapters are involved. So this is for today's session. I hope this session has helped you. So in the next session, you will be able to learn Chapter 20 ICD-10-CM coding guidelines. Thank you.